Thank you for joining us for today's webinar. We're very excited to bring you this interactive experience that will let you learn more about the clinical education at SCNM. My name is Eve Velotis, and I'll be your host for today's webinar. Before we begin, let's take just a couple minutes to familiarize you with the technology that we'll be using today. Hopefully you see the control panel on your screen, and that is what you'll use to, of course, view the webinar today and use to ask questions. So you should see a questions box in your control panel, and you can go ahead and type questions in throughout the presentation, and we'll answer them verbally at the end of the webinar. We anticipate the presentation to go for about 40 minutes, followed by about 20 minutes of questions. During today's webinar, you'll actually be hearing from Dr. Madeline Otto, who is a resident physician here at SCNM. We initially hoped to have Dr. Mitchell share today's webinar with you, but she was called away at the last minute to a special meeting at the state legislature. So we're very appreciative to Dr. Otto for filling in today. Dr. Otto is a first-year resident at SCNM and also graduated from SCNM last year, so she'll be able to provide lots of different perspectives, what it's like to be a resident. She can talk about what it was like to be a student at SCNM, and of course she'll talk about the clinical education here. So as I mentioned, Dr. Otto graduated from SCNM last year, and she is currently completing a naturopathic family medicine residency at our medical center. Her mission as a physician is to provide safe and effective solutions to her patients for a wide array of health concerns. She has an emphasis in classical homeopathy and clinical nutrition for their profound yet gentle healing effects. Dr. Otto is from upstate New York and came to Arizona after her undergraduate work to pursue her passion for health and natural medicine. So with that, it is my pleasure to turn the presentation over to Dr. Otto to talk with you about the clinical education at SCNM. Thanks, Dr. Otto.
Thank you. Thank you for the introduction, Eve. I'm Dr. Otto. I'm really excited to be talking to you all today. It wasn't that long ago that I was in your shoes and trying to figure out what my next step would be. So I'm excited to tell you about what we have to offer here and help you on your path of making this decision, where you're going to go and what you're going to do. So I want to start by introducing our principles. You may all be kind of in different levels of experience with naturopathic medicine, so this is a good place to start. We have 6 main principles. I think they're trying to add on a 7th one there at the end, but the main ones are first, do no harm. This is similar to the conventional first, do no harm, but obviously from our perspective, this is using natural therapies that are non-invasive and non-toxic, and using minimal intervention to get the most profound effect with our patients. The healing power of nature is not just looking at natural medicine, but actually really focusing more on valuing the fact that the body has an inherent desire to be healthy and to operate optimally. And so we try to gear our therapies and our interventions to support the body, give it the resources that it needs in order to function on its own. Discover and treat the cause. So this, maybe a good example of this is, when somebody has high blood pressure, we don't want to just give them a medicine that's going to bring their blood pressure down. We want to understand why their blood pressure is high in the first place and treat from that perspective. So is it their diet that's contributing to it, or is it their anxiety that's contributing to their blood pressure, and that kind of thing. Treating the whole person. For the most part, we're general medicine physicians, and we value the fact that we don't look at the body in a reductionist kind of, from a reductionist perspective. We see that all the body systems and all the body parts are interconnected and they influence each other. And so our treatment approach is from that perspective. The physician as teacher. This is probably my favorite principle. We really emphasize that here at the clinic, and this is where we get to spend time with our patients and we let them be a part of their healing process. We explain to them essentially what we know about what's going on in their bodies, explain to them how our interventions are going to help, and this is a really valuable tool, and our patients absolutely love it. They love being a part of that. They love understanding what's going on in their bodies, and they understand, or they love understanding the healing process. Prevention is the best cure. So this is a very well-known principle of ours, that we don't just try to play defense all the time. We try to prevent serious diseases from happening, so that we're not always treating somebody after they've already had the heart attack, for example. We'd like to prevent them from having a heart attack. So there's some updates to our calendar that are kind of exciting for us. This was a little different from when I was in school. This is starting out this year, where the academic calendar is now 4 11-week quarters. We have 2 starts, one in the fall and one in the spring. And this new organization of the calendar allows for ample study time for our board exams, both after the 2nd year and after the 4th year, with built-in study time or built-in board reviews into the curriculum. So that's really exciting. So these are the dates for you to keep in mind if you're planning on being a fall matric or a spring matriculation. Okay, so in our first year, I want to kind of lay out the overview before we go into detail about them. In the first year, we'll say the first 2 years are kind of like your didactic years, and your second 2 years are your clinical years. But it's a little bit more intertwined than that, because in your first 2 years, on top of learning all of your basic sciences and learning your pathophysiology and lab diagnosis, you're also getting clinical education from day one. So we start this clinical practice that we're going to get into, and we also have the history of naturopathic philosophy, which is something that we really value here in maintaining those principles that we were talking about and maintaining the roots of our medicine while in a contemporary healthcare setting. The second 2 years, second 2 years, years 3 and 4, is going to be your more clinical focus. So we still have didactic work. This is when you're going to get the most of your naturopathic modalities that we'll probably touch more on in a little bit. But we also are going to have a lot of clerkships during this time. This is when you're getting your hands-on experience with patients. In the first 2 years is going to be preparation for that. So introduction to clinical practice. This is a really exciting part of the curriculum that was added about 5 years ago now. And this was to bring clinical experience to the students from day one. And then like the philosophy, as I mentioned. Okay, so what do you do in Clipper is what we call it. What you do the first year of Clipper is the very first week of school, you're learning how to take vitals and learning phlebotomy, starting to understand charting and electronic medical records, as well as patient interview skills. And this is really important. Prior to this change a number of years ago, students were not getting this information and starting to develop these skills until right before they entered their 3rd year, which was very abbreviated, as you can imagine. So this is kind of amazing. This gives you 2 years of starting to practice these skills and starting to perfect them before you actually are seeing patients, quote unquote, on your own at the medical center. You start to take patient cases and start to develop your clinical thinking skills. This kind of goes on par with our human biology block, which incorporates team-based learning. Our TBL course also breaks up into groups and has you practice your clinical thinking skills, working out cases and understanding them both from a conventional and a naturopathic perspective. So your Clipper, which is your the clinical skills portion of that, is sort of in line with that, trying to develop those skills early on as you begin your education and kind of get your brain thinking in those dynamics. You also you have courses in medical ethics, jurisprudence, cultural and social considerations. So there's a lot to medicine outside of just the diagnosis and the treatment part. There's a lot of different situations, different kinds of patient interactions that you can expect to experience while you're here and then when you're a physician that you talk about in detail during your Clipper class. And the jurisprudence, obviously understanding the legal ramifications of those of medical ethics, but also in general what the laws are here in Arizona and how you'll be practicing as a physician. After your first year, towards the end of your first year, you're going to have the first of several standardized exams with a standardized patient. And these are patients that are trained at the college. They're actors, yeah, essentially actors that come in from the community, and they're trained to kind of be mock patients for you. And you will have proctored exams where you'll interact with that patient. They'll have a mock case that they have rehearsed so they can act out their respiratory infection or COPD or what have you, and you will, it'll be a chance to show your competency in case taking and taking vitals and this kind of thing. So this first one is actually before you enter clinic to sort of show your competency for that first year of starting to develop those clinical thinking skills. Also, at the end of the first year, prior to your second year, you have what's called field observation, and this was one of my favorite parts in the first couple of years of school here. And that's because you get to go out in the real world, so to speak, break the medical school bubble and be working with physicians outside of the clinic. And these are NDs, DOs, MDs, a variety of different physicians that we have that work with us. And you're shadowing and you're watching, observing them do things, and you're helping them with little projects, and they're teaching you clinical pearls and quizzing you, and it's a ton of fun. And you get to see patient interactions and experience the treatment protocols and what have you. So this is a really valuable part of the education that we offer here. This will be 44 hours of observation, any number of physicians in any number of areas, and this will be at some point during that first year, towards the end of, or the first 2 years. Year 2, so now you're in your second year of medical school. The didactics is now progressing, and your clinical experience is going to be progressing too. So in the didactic aspect of things, you're going to be doing studying pathophysiology, clinical diagnosis, lab diagnosis. You'll also be getting an introduction to your naturopathic modalities, physical medicine, acupuncture and TCM, botanical medicine, herbs, clinical nutrition, hydrotherapy, etc. And then during what's really cool about the Clipper class, the clinical practice course, is that it correlates pretty well with the general medicine diagnosis, which is the pathophys and the lab diagnosis I was mentioning. So for example, if you're learning reproduction in your Gen Med course, you will be then learning how to do the reproductive, the pelvic exams in your Clipper course. And you will have actual models that you'll be, again, actors that come in where you'll be practicing those exams on. And so you learn a whole host of physical exams and get to practice those for a whole year before you're in clinic practicing them on patients. So this is just super valuable part of the education here. You'll, in addition to learning those physical exams, you're going to continue all the skills that you started to learn in your first year of Clipper. And now that the more knowledge you're getting about pathology and about the clinical decision-making process and didactically, you're now able to apply that to a more advanced level in terms of being able to work up more complicated cases, understanding cultural competency and social diversity, and using more, having more understanding of preventive medicine and preventive measures. We have these great posts. We call them lab, medicinary, and IV posts. And this is to get you familiar, with our medical center a little bit more. It's a little bit less mysterious once you've actually practiced in all these different aspects of the medical center. But it also helps to get your mind ready for practice when you're out and you have these different stations in your own office. So your medicinary post is working in the medicinary, dispensing the many supplements, different products that we offer there, as well as the botanicals. You start to get familiar with the formulations that are made, and you get to actually prepare the individualized formulas for patients that come into the medicinary, obviously being supervised by the staff there. The lab's very similar. You learn about how to collect specimens, how to view them under the microscope and identify them, how that process works, and how to send things off to other labs for culture, et cetera. And then the IV post is pretty cool as well. We do a lot of nutrient IVs here and chelations, and so you get some experience, hands-on experience putting those together and administering those to patients, practicing the IV sticks and different things that we do in there. And I think I mentioned in your first year during that Clipper course, when you're starting to learn how to take vitals and take patient cases, you're also doing phlebotomy, learning how to take blood draws and learning how to do needle sticks for IVs. We also introduced a practice management series, which is our business courses here, and these are really phenomenal. They're weekend seminars where we have professionals come in and both business coach and very successful physicians come in and give you entire toolkits on how to get your business started while you're in school, so that when you graduate, you're all set, ready to hit the ground running. And these are really valuable. These will be integrated in over the course of your second, third, and fourth year, I think. At the end of year 2, now you're getting ready to enter your clinic year. So this is exciting. You get there's a white coat ceremony where you are now entering student clinicianhood. And so you need to prove your competency in order to enter the medical center and be a student clinician. So we have the clinical entry exam. This is a very similar to the standardized patient exam that you would have taken the year prior, right after your first year. And so that exam would be good practice for your clinical entry exam. Now that you have learned so much more information, you've practiced all the physical exams, your clinical thinking is a lot more developed, you will have another actor come in and you will have a proctored exam where you do an intake and do physical exams and go through your differential diagnosis and assessment. And then passing that, you will be entering the clinic as a student clinician. So now you're in your third and fourth year. These are your clinic years, and as I said, we still have didactic work during this time. You're delving more and more in detail into your naturopathic therapies, modalities, and you will also have some other didactic, pathology courses during this time. But the focus is definitely on the clerkship or the clinic experience. So we have 99 rotations a week in the clinic, 49 different doctors that you'll work with. And as a third and fourth year, you'll have a lot more responsibility, obviously, than a first and second year, because you're dealing one-on-one with patients. In your third year, you're what we call a secondary, which means that you accompany a primary or a fourth-year student into the room with the patient. You assist in taking vitals and assist in physical exams, and you basically help facilitate the patient visit. But you're observing. You're kind of the second person. You help out, but you don't usually directly you don't run the intake. And then as a fourth year, you're a primary student, and so you're kind of like an intern, a first-year intern. That would be the comparison to a conventional program. They run the intake. The supervising physician would oversee it. The residents oversee it. But you actually get to do a fair amount of work and really, really hone in on your patient interaction skills and being able to think clinically on your feet. So the picture you have here, we have a patient sitting on the table, the attending physician to the right, that's Dr. Dang, with a resident, and then the primary and secondary student. So you can see the primary student is really, really doing the patient interaction, taking the case and doing the assessment with the supervision of the physician. We have a variety of different kinds of rotations. Most of them are technically family practice, as in they see everybody in the family. We have a few more focused kinds of rotations. One of them is pediatrics. So these are doctors that focus on pediatrics. They see everybody from the newborn exams all the way up through adolescence. And so when you're on these rotations, this is what you're going to see, and you'll get hands-on experience with this. Classical homeopathy, this is another kind of emphasis. So it's a general medicine rotation. We see everything on those shifts, but the therapy that we use is primarily homeopathy. Acupuncture is very similar, treats everything and everybody, but using acupuncture and Chinese herbs as the main treatment approach. IV therapy, we have an IV room. We offer all kinds of different nutrient bags and chelation products for our patients, and so these are integrated on a number of different shifts. We do have, I don't think it's listed on here, we have environmental shifts, focus on environmental medicine, so you'll see a lot more chelation on those kinds of rotations. Pain management, so we have a brand new pain clinic that's going to be focused on this, but we do anything from Perlo injections, PRP, soft tissue, physical therapy, these kinds of treatments. Botanical medicine is integrated into most rotations that are general medicine. This is using herbs and individual formulations to treat patients' conditions. Physical medicine is our physical manipulation. We have a few shifts that are geared primarily towards that. They're musculoskeletal conditions largely, and they're being treated mainly with physical manipulation or kind of a lot of overlap with the pain management. They'll do e-stim, physiotherapy, ultrasound, and things like that. Hydrotherapy is a really cool old school therapy that we still use here, and we have a wonderful hydro suite in the clinic that is amazing. We've got infrared saunas and steam rooms and different machines that we use for hydrotherapy treatments, and we put patients on series of treatments, so they'll come in a few times a week in addition to their regular visits. Mind-body medicine, we have a few rotations that are just for oncology. We just do cancer patients, men and women's medicine, and we have a few minor surgery rotations. We also have a minor surgery suite where these procedures take place in, and this is a great experience as well. So you're obviously using the skills that you've been developing years 1 and 2, you're developing or you're applying in years 3 and 4 while adding constantly to that amount of knowledge. At the end of your 3rd year, now that you've been a student clinician for a year, now it's time to show your competency again to see if you're ready to be a primary student, if you're ready to have primary status, and that's why it's called a primary status exam. So this is, again, we're doing the standardized patient, these actors that come in, but every time you take this exam throughout your 4 years here, it gets more intense and more detailed to show your clinical growth. This is a picture of our minor surgery suite, a minor surgery room in the suite. We have extended sites in our community. These are really cool. These are basically experience that you get that is an extenuation from the medical center. So it's not actually here on campus, but they're going to be run by our clinic and run by our physicians. And we have them in a variety of different, treating a variety of different things. We have substance abuse, looking at patients that have, whether it's alcoholism or addiction to methadone or cocaine, heroin. They have inpatient and outpatient facilities for that. Pediatric medicine, we have Hamilton Elementary that we go to, which is an elementary school, and our students and our doctors run a clinic there and provide essentially free medicine to underserved communities, which is fantastic. Adult family medicine, community health, women and children with domestic violence. This is another really powerful way for us to impact our community, is working with these women that are victims of domestic violence, as well as HIV and AIDS treatment center. We have an extended site there. We can treat these patients very powerfully using naturopathic modalities. There's also the opportunity for students to do elective offsites, and this means that you can either find a physician that you'd like to work with who might be new to our community, or someone who's sort of known in our community, but it's not a physician at the medical center itself. And so you can do rotations with these doctors, and this is really valuable as well. You can work with any kind of physician that you'd like to, whether it's an ND, an MD, a DO, an LAC, etc. We have 132 hours devoted just towards this, and so you get to go to a private practice and see how different doctors run their practices, which this is going to be really different. You will see different electronic medical record systems. You're going to see different kinds of practices, whether it's family practice or pain management, maybe oncology or exclusively women's medicine. You may want to shadow a specialist, an MD who's a specialist, a nephrologist, or a gastroenterologist, for example. And this is the time we infuse this into the curriculum so that you have the time to be able to dedicate towards that and getting advanced knowledge in something specific that you want more knowledge in. Okay, so I would like to open this up to questions.
Great. Thanks so much, Dr. Otto. And keep in mind, Dr. Otto can answer questions about the content that she just presented, but if you have questions about what it's like to be a resident or what her experience was like as a student at SCNM, those are certainly fair game too. Why don't we start with Dr. Otto by sharing with our participants why you chose to apply for a residency.
Okay. I definitely wanted the added experience. Residencies, as some of you may know, but some of you may not, we are not federally licensed. We're licensed by state, and so our residency requirements differ from that of the MD world. Our residencies are fairly competitive because there's not enough at this point to cover everybody, but they're competitive because everybody wants more opportunity to learn more and get more experience under supervision before they're out in practice. That's the main reason that I chose to do it. I wanted to stay here in Arizona because our scope of practice is so wide and so comprehensive.
Perfect. So for those students that choose to not go after a residency, what kind of area might they practice in if they don't go into a residency program?
I like to say that the world is really our oyster when we graduate from here. There's so many different things that we can do, and we can work in pretty much any setting. A lot of my colleagues started, well, a few of them started out on their own, either by themselves or with another one or two classmates. I'd say it's more common for them to join an existing practice. But even that is varied in itself. You can join an existing practice of NDs, for example, where each person has kind of a different emphasis or a different specialty, and you're working together. Some people join conventional practices where they're the ND in a group of MDs or DOs, which is pretty awesome, and kind of really fueling that integrative medicine approach and the team care approach. Other things that people do, they'll do their consulting, they'll work with nutraceutical companies. Those are probably, joint practice I would say is probably the most common.
Perfect, thank you. So again, as a reminder, if you have questions, type them into the question box in your control panel, and we'll try to get to as many as we can. So the next question, can you talk a little bit about OB-GYN and women's practice and what NDs are able to do in that respect?
Sure. We're allowed to do anything that we're trained in, essentially. So if you want to deliver babies, this is going to take some additional training. You're going to need to get a midwifery certificate. There are definitely NDs that do that, and they do just that. I would say if you are going to go that route, that's just like an MD, that's all you're going to do. And we're definitely allowed to do that. We do home birth. We're not licensed generally. It's pretty hard we can't really do that in a hospital setting, as far as I know. So that would be, you'd be a midwife, delivering home birth. I hope that answered the question of whoever was asking. In terms of regular GYN procedures, pap smears, and colposcopies, we are able to do that as long as the colposcopies, we don't get training here at the clinic doing that, but you are allowed to do it if you get extra training in it.
Perfect. Now this might be a more difficult question to answer, but Dr. Otto, can you talk generally about the differences between NDs and DOs? Clearly you're an ND and you're not a DO, so you're kind of talking about it from what you know, but can you generally speak to that?
Yeah, absolutely. My impression from talking to DOs and understanding the licensure a little bit better is DOs are not tremendously different from MDs from our perspective. They do some osteopathic manipulation. They take some of those courses in their coursework, but their licensure and their residencies, they're more in line with what an MD is going to be doing and treating from a conventional approach, because you kind of have to in order to be able to work in a hospital setting like that. So I would say that we get 2 to 3 full years of natural therapies, not just manipulation, but also in clinical nutrition and herbal medicine and homeopathy and physical medicine. So that's an unbelievable amount more training than any other practitioner would get in all of those therapies. It's not like a weekend here, a weekend there. We get years in each of these therapies. Probably the main difference.
Perfect. Thanks, Dr. Otto. Can you talk a little bit about what your 4th year at SCNM was like as a 4th year student?
Sure. My 4th year was split between clerkships and your didactics. So we take a lot of what we call ology courses. So your urology, your rheumatology, oncology, orthopedics. These courses are typically trickled between your 3rd and 4th year. I can't remember which ones are which year. And then you're getting more and more into your natural therapies. So we have, for example, in botanical medicine, we have like I said, almost 2 years of just botanical medicine courses where you're basically taking a class every quarter in that. And so you're getting more and more into that, and that doesn't really stop until you graduate, really. And then on top of that, you're doing your clerkship, so anywhere from 5 to 7 clerkships each quarter, and you have 4 quarters in a year. So you're just seeing, you're probably doing more, it feels like you're doing more clerkships than anything else, where you're just seeing patients and working out charts and working up cases and that kind of thing. And then any other selective courses that you decide to do, which are essentially, you have to do so many extra classes in addition to what's in the core curriculum. This gives you a chance to get more, kind of track yourself. If you want to get more experience in a certain modality, for example, you can take extra classes in botanical medicine or acupuncture or something like that.
Perfect. Can you talk a little bit about some typical cases that you see in a day, and maybe give us a little bit of information about what therapies you use to treat those? Like, do you have go-to therapies? Clearly, you've been trained in everything, but are some sort of more?
Yeah, I think it's reasonable to say that by the time you graduate, there's going to be certain therapies that speak to you more than others. We learn so many that naturally you're just going to gravitate more towards some of them. You just, I don't know, you like them more. It just kind of happens, not on purpose. I would say most people, that happens to most people. So I obviously gravitated towards classical homeopathy and towards nutrition. Now nutrition is in everything. It's like the core of what we do. So that's infused into any shift that you're on. In terms of what we see so many different things. Anything that a primary care physician would see, you know, your conventional PCP's office, that's what we see. So thyroid disorders, anything endocrine, a lot of women's medicine, a ton of women's medicine. We see a lot of GI stuff, a lot of intestinal problems. Autoimmune diseases is something that we see pretty much all the time. A lot of hypertension, heart disease. What else do we see? And a lot of, you know, chronic migraines and a lot of derm conditions, you know, skin problems that people haven't been able to make any headway with using conventional approaches. We kind of see, what I find is that we see like two extremes. We see people who are proactive in their health. They don't want to take medications, and so they come in with like a functional, the really common functional problems that, you know, your PCP would see. And then we see the really extreme cases where they've tried everything else and it hasn't worked, and they find out about us, and now they come to see us. And so those patients are a lot more complicated. They usually have, they're on a lot more medications. They have a number of different conditions that they're struggling with. So we get a really interesting mix of, you know, you could see someone with heart failure and, you know, stage 4 kidney disease, you know, the first hour, and then the second hour you're seeing somebody with really painful periods and chronic migraines. So it's pretty varied.
Great. Dr. Otto, can you talk to NDs being able to practice or not in a hospital setting?
Yeah, sure. In a licensed state, so in a state like Arizona, you can definitely, as a student, work in a hospital. You typically have to set that up yourself. Lots of students have done it. You know, usually just calling around and asking, you'll be able to find physicians that will take you in and let you work with them. Once you graduate, again, hospital work, we work with CTCA, Cancer Center Treatments for America. They host an oncology, a naturopathic oncology residency. That's 2 years, I think. And those are just at CTCA hospitals in various parts of the country. That's the only official SCNM residency that we have that's in a hospital setting. Outside of that, you would be setting that up on your own, which, again, has been done. It's not something, I wouldn't say the majority of our students by any means do that, but it definitely can be done. And while you're a student, it's much easier to be able to get that experience while you're here.
Great. So we have a question about being a single mother and being able to go through the program. We have a lot of mothers going through the program. Can you just kind of speak to your experience with that as a fellow classmate of theirs?
Absolutely. This is a really good question. I myself, I don't have any children, but I have a number of colleagues that do. And, I mean, it's going to be tough. It's going to be challenging because you're in medical school and you obviously want to be a good parent as well. But I would say that there's definitely support here for that. For pregnant mothers and for nursing mothers, we have facilities here to help kind of cushion that so that you're, if you need to, step away, if you need to nurse, if you need to, bring your baby, that, people do that, and it's pretty accommodating in that sense. Like, we try to work with you as much as we can. Outside of that, hopefully having a support system is really important. If you come here and you have a family, that's something that you want to talk to your spouse about, your significant other, and kind of maybe have a plan of action, and maybe talk to the admissions team here to sort of troubleshoot and come up with a plan and make sure that you have a support system when you're here so you can be successful. You can definitely do it.
Perfect. And so along that lines, I think Dr. Otto mentioned, but the program is rigorous and full-time. So currently we don't offer any degree programs or curriculum for working adults. When you come to SCNM, you're really committing to, I say 8 to 5 or really 8 to 8, depending on the quarter that you're in. So it is difficult to have, well, really impossible to have a full-time job while you're in the program. But we do have some students that might choose to keep, maybe 5 hours a week of employment, doing something that they were already doing and are comfortable with before they come into the program. We will be starting some community education classes for those individuals that just want to brush up on things like healthy eating or gluten-free eating, but currently the ND degree program is full-time. What I will add to that, though, is we did recently roll out a 5-year curriculum, and so that spreads out the information in the traditional first year into 2 years, and that's sort of in response to those students that do have family at home or maybe need to slow things down a little bit in the first year, so that makes things a little bit better for them. So sort of along those lines, the next question is, what's the typical age of your fellow colleagues? So I'll let Madeline speak to that in her experience, but from an admissions perspective, I will let you know that the average age of our students coming into the program has hovered around 29 or 30 for the last number of years. So what we're seeing is that we definitely have more students coming into the program straight from their undergrad. We certainly have a cohort of students that have waited a year or 2 to come into the program, maybe because they didn't know about it or because they wanted to take a gap year, if you will. But we still also have a number of students that are doing naturopathic medicine as a second or a third profession because it's something that they've discovered later in life and really have found a calling and a passion for. So those are really sort of the stats, but I'll let Dr. Otto speak to it anecdotally.
Yeah, I would say across the board. I mean, there's definitely an influx of younger people coming straight from undergrad, which is really cool. I don't think, a few decades ago, I don't think people knew about the medicine that quickly. So it's pretty exciting. But we have a ton of people who are, much older than that. In my class, we had a few people actually in their late 50s, I want to say, early 60s. The majority being in their 20s, a lot of people in their 30s, and then certainly in their 40s as well. So like Eve said, it's diverse in terms of the people who obviously come here later. They had a career already, whether it had anything to do with medicine or not. They bring a lot of diversity, and it's actually kind of exciting to work with all those different people with all those different backgrounds and get those different perspectives, especially the people that had a different career in the healthcare field already.
Perfect. Thank you. So another question is in respect to the competitive nature of the residency. So as far as current statistics, what I hear our career services director say is that typically 18% of graduates from SCNM will go on to a residency. So I don't have the exact stats on how many apply versus how many get in, but we're very supportive of the residency application process. And our career services director works closely with students that want a residency and helps them with interviewing and refining personal statements. But I look to Dr. Otto to maybe share some additional info on that.
I'm not sure of the statistics. I mean, it's getting harder to track from my perspective because the number of students that are graduating with this degree is increasing every day, and well, not every day, but every quarter, every semester. And then the number of residencies that are opening up is changing as well. The more integrative our healthcare system gets, the more residencies are popping up all over the place. So I don't know an exact stat. You might have to email admissions about that to get more information.
Yeah, absolutely. I can certainly get a better number for you if you'd like that. So shifting gears a little bit to licensure and practicing in different states. So for those students that go to school in Arizona but then choose to practice in another state, what would that look like from a licensing exam perspective?
So you would, if you knew, for example, if you went to school here, which you would have arguably the most comprehensive education, because we have such a wide scope of practice, we have prescriptive rights, and we do acupuncture here as well as part of our ND program. If you knew for sure that you were not going to practice in Arizona, you were going to practice in Vermont, for example, you could just take the core exam here, not take the minor surgery and the acupuncture addendum, and I'm making air quotes right now, exams, and you could just apply for a license in Vermont. Most people, what they do is they take the exam in Arizona, the three-part. So we have two sets of boards. Let me start with that. We have two sets of boards. The first set is your step 1 is going to be after your 2nd year of school here, and then your step 2 is after your 4th year, and that's a 3-day exam. It includes a 3-part core clinical exam, and then you have the add-ons, which is the minor surgery and the acupuncture. Those 2 exams are required to take and to pass if you're going to practice in the state of Arizona. Obviously, as well as the core clinical, the other 3-part, just the clinical part, is required to practice in any licensed state. So if you were going to move to a different state, as long as you pass the core clinical, you would be able to apply in a license in any state. Every state has a different scope of practice, and so the licensure, applying for a license will be a little bit different. For example, some of the New England states require an additional exam to prescribe pharmaceuticals. Another state might require an additional acupuncture board exams, but not the minor surgery. So you'd have to look at it you'd have to look at your particular state's requirements. But the point that I want to make is that most people choose to, if they went to school in Arizona, they're going to take the entire Arizona board exams, including the minor surgery and acupuncture, and pass them. Once you have a license in Arizona, you can then apply for a license by endorsement, is what it's called, for pretty much any other state. And because our scope of practice is the most comprehensive here, and we have to take the most exams here, you're going to be set. It's probably your best bet, because your options are wide open at that point. You don't have to worry later on down the road that you didn't take an exam for something.
Perfect. Thanks, Dr. Otto. Can you talk a little bit about what your typical week looks like as far as how many patients you see?
I'm going to assume that this is as a resident. So I'm on 7 rotations right now a week. I probably see anywhere from 5 to 12 patients per rotation. So I don't know, you do the math, it's probably better than mine. So anywhere from 35 to, what is that, 50, 60 patients a week when I'm on rotation here.
And again, that would probably be different when you're in private practice, because
yes.
Since we're a teaching clinic, we see fewer patients on those shifts because it takes a little bit more time to...
Absolutely. The students here, because the students are running the cases, that it is a little bit slower of a process. So I would say in private practice, if you're doing like pain management, you'll probably see far more patients, like more like 30 patients a day. Whereas if you're doing family practice, where you are doing you're really interacting with your patients for like a half an hour, 20 to 30 minutes at a time, you're going to see, what is that, maybe 10 to 16 patients a day.
Cool. Can you talk about the research opportunities either in ND school or afterwards?
Yeah, so research, the research in naturopathic medicine is really kind of a blossoming area. We're really lucky here to have, we're right next to ASU, and they have this fantastic biodesign institute, and our main research faculty here, Dr. Langland, he is also an instructor or researcher at ASU Biodesign Institute. And so he, I want to use the word triage, which is not the right word. It's a very, very clinical term. But he facilitates the research, kind of splits it up between what we can do here at our facility, and then he recruits our students to work at the ASU Biodesign Institute. They do, we do like larger group research studies where more students are involved, doing a lot of, like doing the on-the-ground, pipetting and bacterial growth and testing. Botanical resistance is one of our more recent projects. But he also has students doing case reports and doing larger research studies, very different things. And that's going to be different at each school. So if that's something that you're interested in, you should definitely inquire at every place that you're applying to about the program, because the research programs are going to be a little different. And then once you graduate, you can definitely get into research at that point too. We have some ND PhD students I know at this school in particular who graduated from here and then went on to get a PhD in research. They had been doing research throughout their time here and then just continued on.
Perfect. And then I'll just add that twice a year we have a research night where residents and students report out to the community and the public about the research that they've been doing. And there's some really exciting things that have come out of that work.
They are having more requirements on the research in terms of the faculty getting involved and the residents. So if you do a residency, you're required to do research. We do research here as residents. We submit case reports. We work with doctors to submit those and get those published. And our faculty is starting to get do more case reports as well, which is really cool.
Awesome. Can you talk about sort of the changing nature of healthcare and how that is, and sort of what that means for NDs in the future?
Okay. Nature of health is changing. I mean, I think the direction that it's going is really cool. I like when we call the older doctors in our profession our elders, and I really enjoy when they tell us about their experience when they went to school, when they graduated, and then what it's like now. It's like two different worlds. So our medicine is just not only becoming more accepted, but people are super excited about it. When you go out, when I go, I kind of expected, to be honest, I expected to face some resistance from either doctors or pharmacists and even patients, and I haven't, knock on wood, I haven't really had that problem. People are generally really curious about what I do. They're really excited about it. Patients are asking about it. Patients are calling their insurance companies asking about coverage, and more doctors are getting excited to have NDs working in their offices. So I think it's going in a really positive direction. I think we're looking at positive change and looking at being real large components of the healthcare field as our numbers grow.
Great. Would you be able to speak to if you consider naturopathic medicine as a stepping stone for somebody that wants to work in public health or the World Health Organization?
That's an interesting question. I think that sounds amazing. I think that's something that would be really, I don't know how well received it would be, but it would be, I think that would be an important stepping stone. I think we have a lot to offer, especially to in the public health sector and these especially underserved communities. We have a ton to offer, and it's just not being utilized at this point. So if you want to do that, power to you.
Cool. In your presentation, you mentioned that there are minor surgery rotations in the program. Can you talk a little bit about what kind of minor surgery NDs can perform?
Yeah, that's a great question. So we do not do general anesthesia. We're not taking out any appendixes or anything, but we do minor surgery, meaning anything above the, like in the subcutaneous area and above. So we'll remove moles or lipomas. We remove toenails that are infected. What else do we do? Mostly skin stuff.
Yeah. I always say if you want to be a surgeon, probably not the right path.
If you want to be a surgeon, this is not the right path.
We know that allopathic residents get paid. Do you, as a resident, do you get paid as a resident?
Yes. I have an income as a resident, so you're not paid by rotation, you're salaried.
Cool. So you mentioned that some of the patients that you see are the ones that have tried everything and nothing else has worked for them. That's why they come to naturopathic medicine. Can you maybe give an example of one of those patients?
Yeah, I'm trying to think of an example. Let me start vague, and we'll see if a specific example comes to my mind. It would depend a lot on the patient, and this is where maybe one of your bigger obstacles as a naturopathic doc is going to be, is that usually when we're trying to, we at least look to arrest the disease, if not to reverse it. But to do that, especially if it's a severe condition or conditions, we need compliance on the part of the patient. You know, they have to be motivated to make some changes, a lot of lifestyle changes generally, in addition to whatever, supplement or medicinal protocol we put them on. And so this is where you either keep patients or you lose them. And so, there's fantastic cases of people who have been in chronic pain for 20 years, who have been on disability, been essentially unable to get out of bed and been wheelchair bound, who no longer are because we were able to treat them. But it's not just, I don't want to give us all the credit. It's the patient that's able to comply with the treatment plan and is motivated to make a change in their health, and so their body is able to recover and their body is able to do that. So we facilitate it, but a lot of that is going to be based on the compliance of the patient. Hope that answers your question.
Great. Any final questions before we wrap up the webinar? Again, if you do have them, feel free to type those in. But in the meantime, we'll just talk about a couple more things. So, of course, we always say that click on the slide. Perfect. Thank you. So, just wanted you to all be aware that our campus is growing. We recently added a 48,000 square foot addition to our Tempe campus that has a teaching kitchen, a healthy cafe. Dr. Otto mentioned the naturopathic pain clinic, a larger medicinary, state-of-the-art classrooms and study space, larger library and exercise room. So really just exciting time to be not only in the profession, but really to be a part of our community. So we encourage you to come and get to know us a little bit better. We have a lot of different ways that you can do that. Twice a year we have an open house called Discovery Day, and we have one coming up on Saturday, March 14th, so just about a month from now. If you have not been to Arizona in March, you are missing out. It is an amazing time of year to be here, especially if you are coming from colder climates. So we'll definitely encourage you to do that. There's information about that and signing up on our website. We also have a Student for a Day program, which allows you to sit in on classes and also sit in on rotations in the medical center to see what that experience is like. So we hold those typically on Mondays and Thursdays. So again, a great opportunity to get to know us a little bit better. Of course, if you want to do something just a little bit less than that, we're always available to show prospective students and tour the campus and the medical center. So we are still currently accepting applications for spring. We have a few slots left. Again, that's that April start, and for fall, which will begin in October. So if you have questions about admission requirements or what that process looks like, please be sure to email me and we'll get you in touch. We'll get in touch with you and answer all of those questions. So I want to take the opportunity to thank all of you for joining us today, and of course Dr. Otto for spending time with us on short notice to provide such great information about the clinical experience here at SCNM and what her experience has been like as a resident. So again, thanks to all of you. Please let us know what additional questions we can answer or if we can set up your visit to campus. We are here for you through the admissions process every step of the way, and we want to thank you. This presentation has been recorded and should be posted on our website hopefully in the next few weeks if you wanted to watch it again. So thank you very much. We wish you a great day, and hopefully we'll be in touch soon. And that concludes this webinar. Thank you.
Thank you.